absolutely.
Let's talk about dislocation and separation of the, is there a difference?
So there is a difference. Dislocation means the ball comes all the way out of the socket. If you truly dislocate, you're probably not getting it in by yourself. You're probably going to have a trip to the emergency room. Those type of injuries happen with accidents like falls, or in younger patients, collision sports, football, or they're sliding into home plate and they dislocate their shoulder. Whereas a separation means that it moves, but it doesn't go all the way out of socket. So a separation is not quite as severe as a dislocation.
Once you have a dislocation, is it easier to get a second dislocation and have your shoulder pop out?
It sure is. In fact, young patients, our current recommendation is as soon as you dislocate one time, you ought to get it fixed, because there's a 90+% chance that you'll redislocate and do more damage. Now, once you get to the age 40, 50, the redislocation rate is much less. So those patients we try to treat with rehab and exercises and therapy to get them a better shoulder.
So surgery early, what do you do to keep it from popping out the second time?
So the reason it pops out is because the ligaments are loose. I think of it like a hammock, and if one side of the hammock is broken, it's really hard to hang in the hammock, right? I mean, you can hang there, but as soon as you fall asleep, you fall out of the hammock. So what we need to do is need to go and tighten those ligaments so that the ball sits right in the middle of the socket the way it ought to.
You do that arthroscopically also?
That's correct, yeah,
So
arthroscopically.
Everything's pretty much done arthroscopically.
It really is,
now.
except for treating arthritis, we can treat almost everything else arthroscopically.